Good evening, everyone. Happy Thursday. It's really nice to be here again. My name is Kevin McAvey, and we have such wonderful guests in store for you today, focusing on Courtney Fields and Empire State Voices. Depending upon when her flight eventually lands, Alessandra Biaggi may also be joining us, and we also have someone to introduce Courtney Fields. But in the meantime, per usual, I want to start off with a few remarks. So, for those I haven't met, hi, I'm Kevin. I'm a husband, father of three, Bedford resident, born and raised New Yorker, lifelong Democrat, good government advocate, healthcare policy expert. I like to put all of that out from the start because I think it's so important nowadays when we're getting so much different information and there's so much noise out there to really know who we're talking to, where they're coming from, what information do they bring to the table, and where are they starting to skirt around the edges. So it's my pleasure to be here over the course of our Local Leaders and Rising Stars series this spring to introduce you to so many people who are doing important work in our community. As a reminder, the whole purpose of this live stream, how it started and really where it's evolved to, is to equip New Yorkers living in the lower Hudson Valley with information about the issues impacting our communities, helping us to identify how we can get involved and who we want to represent us in government and advance policies to our benefit. Our mission here is to discuss the issues, create a forum to discuss issues confronting residents of New York 17, creating an informed and engaged community, foster community, reconnect as a community around common issues of concern, and ensure our representatives are held accountable for addressing them, and to introduce the candidates, introduce residents to individuals seeking to represent us in government at the federal, state, and local level. And I'll get back to that when we actually talk a little bit about who's on our series this spring. But in the meantime, for those who haven't been tracking, we actually have a congressional race underway and certainly a congressional primary with only 8 weeks, less than 8 weeks to June 23rd, and when Democrats, and I guess Republicans in the district will pick who they want to represent them in the general election. We have, and we are fortunate to have in this election, 5 individuals who are running, all who have tremendous moral clarity and are seeking and are equipped to well serve us. So my question for you is, who do you support? And who would you like to support going into the primary? If you want more information about many of the candidates, I've had the privilege on your behalf to interview them. They're all on our YouTube page at KevinforNewYork, including some in the field interviews with Kate Conley, Peter Chatsky, who has dropped out, Effie Phillips Staley, and Beth Davidson. More information, all available, and we've had tremendous a number of forums you can also tune into online on Facebook and on YouTube. So just check it out. As for me, as I've mentioned before, I chose Beth. Who are you choosing? Why did I choose Beth? For me, I thought she was an experienced policymaker. She has the character and temperament to deliver, and she has deep local roots and commitment to the region. She was here before the last election, and I'm pretty confident she'll be here after the next election, seeking to deliver for those who depend upon her in our community. But I also wanted to share, as I was thinking about today, a little bit of story behind this picture here. When we think about like our representatives being present in our community, it really does bring me back to like why I chose Beth. Beth really prides herself on being present whenever and wherever she's invited. I remember when we were doing an interview in her home, and I'm going to go back a couple of screens here, like that Davidson Home Movies video, which is about 40 minutes of us talking while she's making meatballs, which Mike Lawler then took the time to make fun of in a press release. When we when we actually were doing that, she started off her traditional phrase of saying 95% of life is, and from the other room, her parents shouted out, showing up. It's something that's deeply ingrained in who she is, how she conducts herself, and what she does. And to my surprise, last summer in our little neighborhood in Bedford, we had a little library ribbon cutting. I didn't know what a little library was. It's a box with books that people put in and out, as it turns out, as you're walking by. And yes, that does apparently get a ribbon cutting. And who was at that ribbon cutting but Beth Davidson, not 5 houses down? Neighbors gathered and had ice cream, the kids played, and there was Beth making introductions and shaking every hand. Her tenacity, her deep desire to understand issues, and her collaborative, grounded nature have produced an early track record of legislative victories. And in a region that has a long tradition of deep-rooted leaders, including the late Congressman Nita Lowey, it is on their path that Beth's heads down, show up, boots on the ground campaign treads, reminding us that representation can still be local if we show up. But the most important question today is, who are you voting for? Because in less than 8 weeks, we have to pick a nominee. And before I get to the nonpartisan part of this conversation, I do want to have a word about a post that our congressman put out on Twitter today. I've been actually going pretty light on our congressman for a good while now, 5, 6 months, really focusing on elevating our candidates. But I do want to note his note here that when he agrees with the president, he says it. When I disagree with the president, he says, I say it. I will always represent my district and do what I think is right for our country. And I just wanted to take a moment to say, that's not right. The congressman has defended immigrants so long as the voices in this district have shown up at his door and protested and pleaded with him. He is for an above all of the above energy policy until he takes votes to actually cut renewable energy. He celebrates our allies when it's convenient, except when USAID funding is decimated and our allies are insulted. And for healthcare, he has done nothing to lower the cost and reveled in his ability to poison the well of our moral effort to ensure that every American has a doctor when sick. From me to you, Congressman, and we don't do this often, you've sat silent for 2 years in fear and deference to the president, allowing him to set a new norm for presidential conduct, to dim the light of what we stand for globally, and sow distrust among one another. He is in my view, everything that you've done is a symptom of the greater problem of our time, because I know you are smart enough to know better, but too often you are craven enough to turn away from our moral imperative. 6 months till November, and I look forward to the campaign. So that's the end of our partisan part this evening. I hope everyone gets out and votes for a congressman or woman who represents their interests, their policies, their values. And whoever you vote for, if you vote, I will respect. The rest of this spring, we're going to be highlighting local leaders across the district. Next week, Jan Merchandani from Yorktown, who's running to serve you in our local elections. And she'll be talking about development that serves residents. Brett Yaris the next week, Eric Marmon, Tom will be coming to us from Mount Pleasant the week after, and Samantha will be closing us, really talking about a critical healthcare issue and the crisis of stillbirth in our country. And we're here tonight to talk to Courtney Fields. But before we do that, I'd love to talk to Tracy Aubenauer. Tracy is the co-chair of Indivisible Rockland and a cancer survivor who walked away from a 25-year finance career to work in the nonprofit sector. She's an outspoken advocate for universal health care and affordable housing, not as policy goals, but as basic human rights. She lives in Rockland County with her 2 children and her senior rescue pit bull, who apparently runs the house. I am also very proud to call her a friend. Tracy, it's so nice to see you.
It's nice to see you as well. Thank you so much for having me.
Of course.
We are friends.
We are friends. I know. How did that happen?
And I am just honored to be in your space.
Yeah, well, thank you for having me so often in your space as you're elevating these important issues. And you have been a tireless advocate in the healthcare space for a long time, driven by this belief that healthcare is a human right. Can you talk to me a little bit about your journey with the healthcare system and how that inspired you to kind of take on this cause?
Sure. I had never worried about or even considered healthcare until I lost my job, took the package, whatever you want to call it. It
Yeah.
was 2 years post the financial crisis.
Yeah.
And I think I had raised my hand because in 2010, I kept getting sick and we couldn't figure out why. I just assumed it was stress. So I thought, okay, I had been reading a bunch of articles in the New York Times about people who leaving their jobs and becoming sommeliers and all these cheesemongers. And I was like, I'm going to take this package and do something wonderful with my life. So I took the package, thought I'd find a job closer to home or, do something fun and exciting. And within about 8 months of taking the package and being on COBRA, and I had very good insurance, I was with a Wall Street firm, with about 8 or 9 months of taking that package, they finally figured out what was wrong with me. I had a very rare sarcoma. So it's myosarcoma. It was muscle-based cancer in my left leg. And I wasn't worried. I had insurance. I had this COBRA. I figured it was going to be fine. I ended up having a 5-pound tumor removed from my left leg.
5 pounds.
Yes. And then they gave me the wonderful news that my preliminary scans before going into the OR, it had metastasized to my lungs. So I also lost the lower left lobe of my lung. So I had a surgery in April. Yes. I laugh now. That was 2011. So it was actually right around this time where we're 15 years. I got out of the OR from my leg, got home. 4 weeks later, I was back in the OR having lung surgery. And then 4 weeks post that, I was having radiation. 38 treatments, drove myself every day, came back every day. And I was very lucky to have the help of my father who helped me take care of the kids and get them on the bus and do all that stuff. So I was blessed. And I really had no financial worries when it came to my healthcare. I had stunning healthcare. What ended up happening was I was done with all my treatments. I was released from radiation late July. Ended up flying to Australia for my sister's wedding. Came back and got a terrible infection and from these cancer treatments because we'll get to the outcome, but the radiation had created some side effects and went to go extend my COBRA benefits. I had this 6-month extension option. And when I submitted the paperwork, they came back and said, sorry, you have a pre-existing condition. It was right in the window of Obamacare being approved, but the ACA portals not being developed, right? So we're in that window of 2010 to 2013. So by the end of 2011, I have no insurance. So now my need to get updated scans and check to make sure that the cancer is not returning, that's all out the window because I can't afford $1,500 plus a scan. And in addition to that, I had an 8-year-old and a 5-year-old. And so you lie awake at night and you worry that one of them is going to fall and need stitches or one of them is going to get sick and need to go to the hospital. I became the bottom of the list in terms of a priority, but you also worry the cancer is going to come back or there's going to be a side effect or something else that goes wrong. And so for 2 years, we lived like that. And you muddle through, right? You're a single mom. You don't know what to do. So you figure it out.
It's no one more powerful than a single mom out there.
We're resourceful. We can stretch a dollar and we can come up with some solutions. So that was 2011 to 2012 to 2013. I lived with that anxiety and the unknown and you're not getting a physical this year because your grade doesn't require it situation, but your sister's going to get one because she needs vaccines and her grade, there's always that off year with school. They don't always need to have a vaccine. And you can finagle it. I did all of that. We went to the dentist. We had to decide, do we pull a tooth? Do we fill a tooth? These are the terrible decisions you have to make as a mother when all you want to do is provide for your children. And so we got to 2013. At this point, I make the crazy decision to start my own business and become a sports therapist. I went to massage therapy school, jumped ahead, did medical and sports certifications, and somehow accidentally found out, because again, I was completely unaware, maybe even apathetic, right? I've just gone through cancer treatments. I'm raising 2 small kids. I didn't even realize the ACA portal was available. I didn't realize that I would qualify for it. You know, my whole life, it was always like, if you're a freelancer,
You don't know. Yeah.
options, right? You got insurance through work, period, end of story. And I was now self-employed. So what do you do?
So what did you do? I mean, I've known you and we've been through so many. I feel like I did the whole story from.
I applied.
Yeah.
So end of 2013, early 2014, we get approved for insurance on the ACA, all 3 of us, right? All 3 of us.
Yep.
I get the tax credits because I'm self-employed, right? So I get a very significantly subsidized payment. If I remember correctly, I was paying like maybe mid 200s. And within a couple of months of that, I have the next iteration of what cancer is going to do in my life. And that's my leg breaks. So now what do? You're a small business owner. You can't work. I was a sports therapist working with athletes. So I was lifting up 275 pounds, 6, 7 guys on the table, you know, doing physical therapy stuff. I can't work now. So I have to apply for disability, which then allows us to qualify for Medicaid, all 3 of us. And then ultimately I qualify for Medicare.
Yeah.
Because there's a waiting period.
Yes.
And then I think what people don't realize, and I'll tell my story now, the hoops you have to jump through. So when we talk about this idea of people who are eligible, and I'm only, you know, concerned about eligibility.
It's easy to get on Medicaid and Medicare.
Easy. Yeah. If I tell you the waiting period, the paperwork, the additional paperwork, the paperwork for the paperwork, it took months of gathering, explaining, writing documents,
justification,
talking to people. It is not a process where you just go, hey, I need Medicaid, or hey, I need disability.
Yep.
That paperwork is extensive, and they make you feel like you are the worst person in the world. Yeah. There is so much shame around it. I was very tight-lipped about it.
About being about the ability to see a doctor when you're sick.
Correct. Or to access the money that you've paid into a system so that you can support your family while you're figuring out who and what you're going to be during a debilitating illness or injury or whatever else. So long story short, we remain on the ACA from 2014. 2017, I finally qualified for Medicare for myself, which is when I had to make the difficult decision to amputate my left leg. The side effects from the radiation were what ultimately took my leg. That Medicare got me quality healthcare at NYU. I was very grateful. I was in the hospital for 5 weeks to learn how to walk again. And then it was a full 2 years before I could walk on my own. I spent the first year in a wheelchair and then walked. So that brings us to 2018. Yeah. I'm on Medicare. Kids are still in the ACA. Things happen. My son comes off for university. He left New York, so they wouldn't take his insurance. We had to pay through the school. My daughter just came off in May of 25. I got a job that provided us with amazing health insurance. And so I'm blessed to have a job that gives me amazing health insurance.
Yes.
So now I'm overinsured, technically. My daughter comes off. We're all covered. I am now facing yet another surgery at the end of May. So it's essentially a re-amputation or a revision. And it requires lots of sign-offs. And so now I have my work insurance and Medicare.
So you've had this journey that's really not only kind of presented you tremendous, literally life-altering challenges, and also the harrowing feeling of you and your family being on the edge and at risk without access to the healthcare system. That seemed, and also like a firsthand experience of understanding how broken and fragmented our healthcare system is. That brings you to not only serve as an advocate, but I'm assuming that's how you got connected to ESV.
Yes, absolutely. Yeah. So in the work that I do with Indivisible Rockland, we try to bring educational events to people. So we partner with groups like ESV, and they had asked us if we knew anyone in the communities who had a story to tell. We were hitting brick walls everywhere we went. And I can tell you from firsthand experience, It is absolutely because of the shame involved with telling your story. It requires you to share parts of your life that can be embarrassing, that people will judge you for. And I can also tell you, I did everything right. A 6-figure job, I had a 401k, I had all that stuff. And I was 2 crises away from being completely decimated.
Which kind of describes virtually everyone in our district.
Yeah, absolutely. I mean, Rockland County alone has 35%, I think, of the total Medicaid recipients in New York 17. So think about that. We have marginalized groups throughout Rockland County that are greatly impacted. We have 2 hospitals in Rockland, and both of those hospitals are on the list of 45 that are at risk for closure.
Yep.
So what does that say about our representation in the district if both of our hospitals are on the list? We lose one of those, and the potential for loss of life skyrockets, right? Someone who has a heart attack has to go to Westchester or New Jersey to get care, and God forbid we lose both. Then what happens? What if you have a mother who's in the middle of giving birth and there is an issue?
Yeah.
She's got to go to a different state or a different county.
Did you meet Courtney when you first kind of started getting involved in ESV?
So funny thing about that is my story got told, I think I started in December. I went through a process of, having them vet my story and make sure that everything was factual. I think my first ad aired in January, and I thought I was done. I was like, okay, I'm done. I don't have to worry about that again. And then I got a phone call saying that they were going to air a new version of the ad in April. And that's when I got introduced to Courtney. And I can honestly say the April experience, the team at ESV is amazing, but the April experience was wonderful, right? We had a plan in place. There were discussions. We talked about the timing and what that was going to look like, and really how we were going to get messaging out and how I could effectively get messaging out. Because again, this is a hard story to tell and it can get emotional. And I have come to tears just remembering what it was like to choose not to treat my child for something that might be uncomfortable for them, or choosing to spend the money and then worrying about, am I going to be able to make that credit card payment?
Well, it's a very vulnerable part of your life. And I think what ESV is doing and what you've been advocating for is that no American should feel like they're in this position of extraordinary vulnerability for themselves and their family. And as we think about bringing Courtney on, do you have any questions that you'd like me to pose to her?
Yeah, absolutely. So as someone who is active in the space, right? Getting out information on healthcare and affordability in the district. I think people are still too comfortable, right? Like, where are the red lines, and how can we actively engage constituents in the district to get involved, tell their stories, or if they have firsthand knowledge, how can we effectively help them communicate that to their neighbors and their community so that other people can start to realize that just because they might not have experienced it personally, it's still going on for other folks. And I think the key here going forward into the future is that we're building a community, and ESV allows us to do that, right? So Empire State Voices helps build that.
Great question. I'm going to have to pose it to her. Tracy, I so appreciate you coming on and sharing your story and really grounding this conversation in lived experience, a lived experience that I think many in the district can relate to. Many of us are 1 or 2 healthcare crises away from some severe financial risks for ourselves and our families, and really appreciate you coming on and all that you do.
Thank you so much. I appreciate you as well. You've been getting all this information out, and I'm so excited for you guys to have a conversation with Courtney. She's amazing.
She is amazing. Let's bring her up, and I'll let you say hi, and then I'll get you off and going. Hi, Courtney.
Hi. Thank you so much for that. Tracy, you're a powerhouse.
She is.
I actually first learned about Tracy in February, my first day at ESV, because of her advocacy and because of her voice, and all of the things that she's already doing in the district. And I'm so happy to know you, and I really appreciate you introducing me. And I'm really excited to be here to join this conversation. Thank you both.
Of course. Thank you, Tracy.
This whole experience amazing and very comfortable, and I'm very excited to see what you'll do in the district. So thanks again, guys.
Of course. Talk soon. Courtney, so now I'm going to publicly embarrass you with your bio. So this is my favorite part. Courtney Fields is a seasoned advocacy and communications leader with over 15 years of experience leading high-impact campaigns across government, nonprofits, national organizations, specializing in driving issue advocacy and accountability concerning healthcare, economic policy, and the real-world impact of political decisions on American families. That experience is going to be really important here and really important now. She's managed multi-million-dollar initiatives, worked closely with elected officials, community leaders, national partners to build coalitions, deliver results. You're known for like this being able to distill the complex down to the simple and accessible. You're a recognized White House Speaker and Presidential Proclamation honoree. You bring deep experience in the American political landscape, and you have a track record that matches it. Courtney, thank you for coming on.
Thank you so much, Kevin. I really do appreciate you having me. Thank you.
Yeah, of course. And so like I am so fascinated, and like one of the reasons I wanted to do this series by leaders in our community who decide to take on an issue and drive it forward and make a difference. And you have one of those issues that I think is a concern, and like statistically, like depending upon the survey, between 2/3 and 3/4 of Americans are worried about healthcare access and affordability, and including those in New York. Like, why is this issue so important to you? Why did you decide to take it on?
Well, I'm a native New Yorker. I am actually from one of the poorest congressional districts in the state, actually in the nation. And where I'm from, a majority of children and adults have asthma as a result of environmental impacts. That requires inhalers and care that can get quite expensive. I know families personally that have chosen food over medical care. Healthcare is an issue that touches every single person, and access to care shouldn't depend on your income, your zip code, or your luck, in my opinion. And that is just one reason why I'm so passionate about this topic and why I am so excited to talk to you today.
Yeah, so talk to me about the state of healthcare access and affordability in America. What do you see as the most pressing concerns? We heard from Tracy, one person's lived experience. She came from a fine financial background even, and still she wound up in a really perilous situation.
Right. And Tracy's story, while it is unique and special to her, it is common, right? Like to have a major impact to your life and to your healthcare that can just throw you for a loop. The biggest issue, in my opinion, right now is how the Republican tax law impacts our everyday. Costs are rising while coverage is becoming less stable. Gas prices are skyrocketing. As have grocery prices. I don't have to tell you, we all eat. And that's a real affordability crisis that we're facing. And unfortunately, we're seeing policy choices voted for by representatives like Mike Lawler that prioritize tax breaks for the wealthiest Americans over healthcare access and breathing room for everybody else. Those policy choices have real consequences for families. And yeah, I definitely, it is my passion to do something about it.
Yeah, so I mean, you mentioned some of the policy choices. Have there been any policy choices over the past couple of years that have really increased the risk in our healthcare system?
Absolutely. I mean, we did have a global pandemic 6 years ago now at this point, and
can't believe it's been 6 years.
Yeah, I really that's where my mind goes. It's almost as if we've forgotten in a lot of ways. But those of us who have been impacted, those of us who have maybe lost someone, we haven't forgotten, right? No. It's not easy to just get over. And the Hudson Valley was deeply impacted. The impacts of a global pandemic on the Hudson Valley can still be felt today. And because of Republican tax law, these cuts to Medicaid up to 30,000 Hudson Valley residents could lose coverage. And so when I think about how COVID impacted everything, every sector, I'm also, faced with the reality of what that means, what hospital closures could mean additionally for the Hudson Valley and for New Yorkers. As Tracy shared, we have 2 Hudson Valley hospitals that are facing closure or cuts. If you're Nyack and Good Samaritan specifically. So it's really scary, and we aren't sure why Rep. Lawler keeps voting for these cuts. But it's with the global pandemic in our rear view, it's just, it doesn't make any sense at all. How we could move this way with healthcare, knowing what we know about healthcare needs and affordability and access. I really do wish there were real solutions presented, but at the moment, this is what we're facing.
Yeah, and it's not only Medicaid patients that depend upon access to those hospitals. When those hospitals face these fiscal cliffs, as you've been seeing reported in the news, they have to cut back on services or try to raise prices as market allows for others in the community, and that affects everyone.
Everyone. If you are facing a life-threatening event and your nearest hospital is now closed due to cuts, it just goes from there. It is a domino effect. It goes from there. And it's really shocking and scary. And I think there's something that we can do about it.
What can we do about it? Because it does feel like this is not a new issue. It does feel like this is becoming more and more of an acute issue over time. Like, are our politics and political system just broken? Like, how can we get to real solutions?
Yeah, I wish I could say that our representatives were trying to get real solutions for real New Yorkers. But as we're talking today, I have some concerns. At the end of the day, this is about affordability. This law raises healthcare costs for Hudson Valley families, and it takes coverage away, and it funds tax breaks for the wealthy, the wealthiest among us, and it doesn't leave much room for anybody else. In District 17 specifically, we're really shocked. I cannot understate it. Like, we're really, really shocked that native son Mike Lawler would vote for such drastic cuts. And he's voted for them a few times. He's doubling down consistently. And so what we're hearing from his constituents and from our neighbors is that they don't think that his voting record is supporting solutions to their everyday problems. And that includes the growing affordability crisis and healthcare crisis that we're facing today. I think that is why people are raising their voices and turning to, shows like yours, right, to find out information on what they can do to find solutions for their everyday problems. They are not being solved by the representatives, or not being represented at all.
Yeah. I'm going to butcher a quote by Maureen Dowd, which is something along the lines of, any jackass can burn down a bar, and it takes a man to build one. And so much of our policy making, in my view, over the course of the past 2 years, and people can do the correlation there, have been about breaking things down and claiming victory, as opposed to trying to take on big issues, bring people together around solutions, and actually make those solutions real. And in my estimation, Representative Lawler has done absolutely nothing to reduce the cost of healthcare for folks, but has really reveled in the fact that he can make it harder for people to get access to a doctor when sick.
It is truly shocking, especially since he's a native. Like, this is happening to his neighbors, right? Like, we are
his community in Rockland.
His community, right? And he vowed to protect and represent. And, consistently we're seeing those votes come down where, he's, even today, a vote doubling down on SNAP cuts. So when you add up SNAP cuts, healthcare crisis, gas prices, what we're facing is real. It's a real affordability crisis. And I think that our neighbors are clamoring for a solution. And I believe that that's what my organization brings. We try to bring solutions. We try to amplify voices. And we host events. We do a lot to really, work with people who want to work with us. Like,
Yeah.
let's do something about this. Let's help each other. We're really all about that.
So tell me a little bit more about Empire State Voices. Like, what are you seeking to accomplish and how are you doing it?
Yeah, ESV is a group of Native New Yorkers working hard for other New Yorkers, quite simply. We work to uplift real stories. Tracy, as you heard, is one of those people that we worked with. And we really work to hold elected officials accountable to their policy choices so the impact can't be ignored. We're really proud to work with teams like CWA, 1199, NYSNA, Indivisible Westchester, Indivisible Yorktown, Planned Parenthood, Protect Our Care. I don't want to leave anybody out. Peacekill, progressives, and other local officials as we do this work. We know that New Yorkers are strong because and resilient and hardworking because the team is and the people that we meet are. And we're really excited to continue to amplify those voices and really work shoulder to shoulder. You know, we know how hard it is to make ends meet. And success for us is getting Mike Lawler to do the work of protecting healthcare for his neighbors and to do something about this affordability crisis.
And why do we need accountability? Why is it important for a constituency to be educated about the issues that are affecting them, and how does that translate into holding a representative accountable?
Yeah, I think that that's a really great question. What's at stake, honestly, is whether families in New York 17 can afford healthcare moving forward. Right now, as I said, we're looking at hundreds of thousands of people who are expected to become uninsured, and that is terrifying. It's terrifying for them, and it's also it should be terrifying for everybody else because it drives up costs and it strains care locally. Nearly 500,000 New Yorkers are at risk of losing their essential plan coverage. And that includes many in the Hudson Valley. And so for folks that don't know, the essential plan covers 1.6 million New Yorkers. And for that key reason, that's why a lot of families have been able to even afford coverage. So that hangs in the balance with the Republican tax law. You know, this one law pulls $7.5 billion a year out of that system and puts that entire program at risk. These are the direct results of policy choices. Votes by people like Mike Lawler have supported cutting healthcare access, and accountability really means making sure that those choices are visible and families have a say in what happens next. I really do believe that, success for us as a team looks like continuing to amplify the voices of real New Yorkers, protecting that coverage, demanding Mike Lawler pay attention to his hometown, and demanding that he stop these harmful cuts. We're holding him accountable to the people that he's vowed to protect and represent.
Excellent. And I'm so glad that you are. The more voices that we have amplifying these issues, putting a spotlight on the votes that our representatives who are supposed to be serving us are casting, the better. And to that end, I want to go back to, in a minute, I want to go back to Tracy's question, which is how can people who just might feel paralyzed by the issue, who know it's important to them, but not quite know how to get started, get started? But I want to kind of run down a couple of statistics, which I found just so compelling. We heard Tracy's lived experience to this, but when you kind of back out to the national level, which is very much reflective of how much what New Yorkers feel, West Health Gallup research found that 1/3 of Americans have made at least one daily living trade-off to afford healthcare, including skipping meals, driving less, or cutting back on utilities. The financial strain is also altering major life milestones, causing an estimated 24 million Americans, nearly 1 in 10 Americans, to postpone retirement, while others have delayed buying homes or growing their families. Kaiser Family Foundation have found that healthcare costs have taken over at voters' top economic concern this year, and 2/3 of the public say they worry about being able to afford healthcare, ranking higher than worries about affording utilities, food and groceries, housing, and gas even. And we all know how expensive those are. And then finally, in a study from Georgetown, 77% of Americans believe that healthcare in the United States is unaffordable. 82% believe the system needs major changes or a complete rebuild. the American healthcare system isn't working for Americans, while we have some Americans who continue to get wealthier and wealthier by the choices like you described that our congressman continues to make. What can people do to get involved?
Yeah. You know, I know it can be scary to tell your story. It can be scary to speak up and speak out. But we can all be an advocate. And the most important thing people can do is stay informed and speak out. Don't let these cuts happen without a fight. Protect Montefiore, Nyack, and Good Samaritan. Call Mike Lawler, ask him to stop voting to cut healthcare, and share your story. Share your stories. That's how we right this ship. Connecting with Empire State Voices is, of course, a great way to get started as well. We are always happy to connect. We're in the district. We host forums. We are actually having a coffee chat next week. Stay tuned for that. You can, follow us on social media. You can find us online at empirestatevoices.org. We've launched a Substack for those who are there. And yeah, we are always around, and we are happy to help and happy to support New Yorkers as we all navigate this affordability crisis. It impacts us all. And tax breaks for the ultra wealthy, while the rest of us struggle to find hospitals that are open. Not really my idea of the American dream. So
EmpireStateVoices.org. Follow Empire State Voices on Instagram. Anything else that you'd want to share with folks who are tuning in tonight or in the coming days?
Yeah, thank you so much for staying involved and staying active. And yeah, please do get in touch with Empire State Voices. Find us in your district, and we'd love to connect. Thank you so much, Kevin.
Courtney,
really.
We're so lucky to have you as a leader in New York and in our district. The work that you're doing is so important, and I'm just privileged to get to see it all the time through our work together.
Thank you.
Have a wonderful night.
Thanks.
So everybody, that was Courtney Fields, the amazing Courtney Fields, who's leading Empire State Voices, doing yeoman's work and actually raising these issues, elevating these stories, like Tracy's earlier today, the stories of so many Americans and who face the stigma of losing health insurance, of fearing for their health, that the health of their families in the most wealthy nation in our country. And all because our representatives quite often do not have the bravery and sometimes the wherewithal to actually step up and say this is a problem that we need to address. Really appreciate Courtney coming on. Next week, we will get to talk to Jan Merchandani, who's going to be running for in Yorktown and talking about development that serves residents. Brett Yaris to come from Putnam County, running for supervisor, to talk about community college, trade school access. Talk to Eric thereafter about what residents actually want from their representatives. Tom about advocating for people with disabilities, and Samantha to close us out with preventing the crisis of stillbirth. Again, it continues to be my privilege every week to get to lift up these local leaders and the tremendous work that they're doing. Thank you all for tuning in on a Thursday night. It's great to be here. It's great to see you. We'll talk more soon. Have a good night.